Welcome, everyone, to the next installment of World AIDS Museum's Spotlight Series with Andy Ruffner, who's the Director of Education and Programming, and me, Raquel, who's the Director of, who am I say to myself. I'm the Executive Director for the World AIDS Museum, and we are lucky enough to have Dan Royles, who has written an incredible book called to make the wounded whole, the African-American struggle against HIV. And I thought, having had a conversation with you earlier about this book, I was really intrigued of how did this book come about, and how did you find yourself in the intersection of HIV and AIDS?
Yeah, thanks for having me. I'm really happy to be here in conversation with you. The book started when I was in grad school. I got my PhD in history at Temple University in Philadelphia. And I was taking a research seminar. It was in my second year. And I had to write a research paper on some aspect of social movements in like post-1960s America. And I had grown up with the AIDS epidemic. I have never known a world in which we didn't have AIDS as like a major crisis. So one of the things that I was interested in was looking at AIDS activism locally in Philadelphia, where I was in school. And I had a kind of an idea, like a vague idea about what that would look like, even if I hadn't really formulated that for myself, or even if that wasn't conscious. I had an idea that this was going to be like a story about kind of white gay men maybe act up in those like 1987 to 1992 years. That was kind of where the focus of the story was going to be. But one of the stories that I found when I got into the archives was the story of a group called Babashi, which stands for Blacks Educating Blacks About Sexual Health Issues, which is one of the first Black AIDS service organizations in the country. And their founder, who was a woman, then was known as Rashida Hassan. Today, she's Rashida Abdul Khabir. And she was and is a Black Muslim infectious disease nurse, straight, wears a headscarf. And she, started seeing patients in the early 1980s, started seeing African-American patients in Philadelphia who didn't match up with kind of what the face of AIDS was at the time, which was white gay men. And so she got involved with some of the local AIDS service organizations that had been started and were predominantly staffed by white gay men, and kind of found that they were not doing as much outreach to Black gay men as she thought they should, and not doing it in the ways that she thought they should. Because for Black gay men, the kind of gay neighborhood in Philadelphia, which is called the Gayborhood, was really, in many ways, an unwelcoming place. To get into bars, they had to present, 3 forms of ID. They were ignored by bartenders. They, were fetishized by some of the men who were white men who were there, looking for sexual partners. And so kind of Rashida and others were arguing that these organizations needed to get outside of the neighborhood in order to reach people who were at risk. And that was, at times hard for those organizations to do. So she split off from them in 1986. And started Babashi, which grew very quickly into, one of a couple of major AIDS service organizations for people of color in the country. So that whole story, from who Rashida was to this conflict in the neighborhood over, race and sexuality and identity and discrimination, like these are not the stories that I expected to find, or the people that I expected to find when I went looking for the story of AIDS in Philadelphia. So I thought that was really interesting because for me, it kind of like exploded this idea of what the story was going to be. And I figured that, if this story happened in Philadelphia, there's probably many stories like this elsewhere, and none of these stories have kind of made it in or had made it in at that point to our larger historical understanding of AIDS in America. And so I set out to tell some of those stories in my dissertation, which then became my book, To Make the Wounded Whole, was to kind of open up or start a conversation within historical scholarship about this facet of AIDS activism that really had been, under-recognized, underappreciated, underexplored up to that point.
I asked you this. It's interesting that as a white male, to be able to write a story like this, how do you feel? How did you get accepted, number one, and to be able to tell their story? Because I think that's a valid question that people who are going to be watching this are going to say, well, what makes him think that he can write this story? And I just asked that of you because I think it's an interesting intersection in what you thought you were going to be writing about and what the reality of HIV, and even now in an historical context, because most people will focus on the gay white male and not see the whole totality of what HIV is.
Yeah. One way that I got to, so one really important aspect of the research for this book was doing oral histories, sitting down with people, for, hours-long interviews about their experiences, in their lives, like across the totality of their lives, but also specifically in the realm of AIDS activism. And so, getting to interview some folks like Rashida early on helped because then they were able to vouch for me and encourage other people to speak with me, which is not to say that, everybody wanted to. I can think of at least one person who was really resistant to that idea. And I can understand why. And I think that if I weren't able to understand why, that would say something, that would be a big red flag for the book, right? Because there's a strong theme or a major motif here about, white people, generally well-intentioned, getting it wrong. And so I can understand why people would be kind of wary of having a white scholar, tell this story. So one really important thing for me was to do oral histories that are so much about sitting with other people and listening to their experience, and just listening to their experience, and not, thinking about what you're going to say or interrupt, anything like that. It's really an act of like deep empathy and identification. And to me, that was so important for being able to tell the stories and what I hope is a really, a really empathic way. That was really important to me. Another thing that I really wanted to make a feature of this project was that, with the oral history project that goes alongside this, where I've interviewed a bunch of people and not all of them show up in the book. All of the interviews kind of inform the book, but not all of the people who I interviewed, have their voices in the book. All those interviews are going to be archived. And so they're all going to be a resource for other scholars to use down the line. I also have a digital archiving project that preserves some material that I've collected in doing those interviews. So, the whole thrust of it, from pretty early on was to not only tell this set of stories, but to lay the groundwork for other people to tell other stories later on, so that, as I say in the book, this is not the book on African-American AIDS activism. This is a book on African-American AIDS activism. And I really hope that other people will come along later. I'm sure they will, to tell other stories. So, it's also part of it is just like recognizing that I am, or I hope to be, an outlet for those voices to make it into the folks who, somebody who can amplify those voices, and not just to be the only person in the conversation.
You know, it's a fascinating process, and I'm wondering what were some of the surprising things that you came across, because the whole thing from the beginning, you know, you started out and you researched this, and you kind of found this topic, or this direction. So then once you waded into it, what are some of the things that were the big aha moments for you in this, in this process of talking with people?
I mean, one of the things that I found really interesting, and I think was pretty unexpected, but ended up being a really important part of the book, was just how international or transnational this activism could be, going back very early. So Babashi, the group that I talked about in Philadelphia, they, under the auspices of the WHO, went to Cameroon, I think in 1988, or staff went to Cameroon in 1988 to advise people on how to do kind of grassroots HIV education and prevention in Africa. You see other groups doing kind of similar work. The WAM Gilead, which is a group that does AIDS education with Black churches, expand from the United States into several sub-Saharan African countries in the late 90s and early 2000s, as well as the Caribbean. There's a group called Sister Love out of Atlanta that does work with Black women in HIV. They've had a second headquarters in South Africa since the early 2000s. And I just thought that was really interesting how I was aware pretty early on that, like, the story about the origin of HIV being in Africa was really complicated for people. That's something that I was very much aware of early on. What I didn't expect as much was to see activists kind of, in a way, like completing that circuit back to Africa or to other parts of the African diaspora, you know, and making kind of interesting arguments when they did it. Sometimes the argument is like, well, as Pernessa Seal, who's the CEO of WAM Gilead, says, Black people do Black church all over the world. That's a really interesting claim to make, that like kind of the Black faith experience is essentially similar in all parts of, or among like all kind of African descended people. That's a really interesting claim to make. That's a logic that undergirded a lot of thinking about, AIDS in Black America versus AIDS in Africa. So that was just a really interesting dimension of these stories for me, and one that I really tried to bring out throughout the book. We see like different examples of it, but that's just kind of one thread of that.
I think that's really interesting, that the connection between the African diaspora that is set in the United States versus the African diaspora in the Caribbean or elsewhere, in that there is this thought that it has to go through the church in a way that just by the mere name of a diaspora, that to me it implies there's a lot of diversity in Black thought. And so how did you see, for instance, this the first woman who is Muslim going into communities? There's a stereotype. We all stereotype people. We stereotyped HIV from the beginning. And I love the stories of women and people like this young woman who said, it doesn't matter where I have to go to tell the story or to help somebody, I'm going to help somebody. And I think that to me is the crux of where we need to be in this conversation globally. Is it doesn't matter where we need to go to be able to help end HIV. We all must go there. So how did she go into different places and be able to garner the support that she did?
Yeah, I mean, she went into lots of different places, and I think kind of used different strategies depending on the place. She tells stories about going into a Black gay bar in downtown Philly to do, to show gay men how to, put a condom on during oral sex, how to do cheeking, which is really a kind of a great story where, I think being able to talk to, I think in that specific sort of like the element of surprise goes a long way actually toward like kind of garnering your credibility or building your credibility with people. They don't expect, this woman in a niqab to show them how to put a condom on with their mouth. And in other cases, she was going to, talk to sex workers on the corner, going into public housing to talk to poor women or working class women about, mitigating their HIV risk. And, I think in each of those cases was able to find points of commonality or shared experience with people who weren't being talked to otherwise. Or, if she wasn't able to do that herself, she was able to identify people to do that. So, Babashi had, for a time, kind of street outreach teams going to talk to, Black gay men or Black men who have sex with men in cruising areas, like, very late at night. Or, had some women in the organization, actually her mom, who was not Muslim, who could do the church lady thing, or who could talk to, faith communities or talk to pastors and that kind of thing. So, I mean, part of it is, there's kind of two things here, right? It's like, one is having the openness and the empathy and the understanding to talk to people who are different from you, but also recognizing that you're not always going to be the right person to do the talking. And sometimes it really is about finding who's going to be the most effective messenger to deliver that message. Being able to do both and knowing when to do each. But I think that's a big kind of theme in, AIDS education or health communication, is recognizing those two things and then knowing when to use each.
Yeah, wow. I mean, that's really big, because we bump into that all the time, and in assumptions that people make. And I think it's interesting the parallel that you're making there. I mean, if you're thinking about you're going in and you're entering a community, you're making a connection in the same way that she was. And putting herself in these situations. I'm curious. I don't want to do a spoiler alert here, but I'm curious about the title of the book, "To Make the Wounded Whole." What's the, without giving all of it away, we want people to go read the book. But how did that come about?
Yeah, the line comes from a Black spiritual. There is a balm in Gilead. There is a balm in Gilead to make the wounded whole. There is a balm in Gilead to heal the sick soul. And that's where the name, the Balm in Gilead, the organization that works with Black churches, is where they get their name from. And so I think the first time I had heard that was when I was interviewing Cornessa Seal, and she sang those like two lines from the song. And it took me a while to kind of figure out that needed to be the title of the book. But I got there eventually. But for me, it fits so well because the two things that the book is about is how African-American AIDS activists use their activism to make the wounded whole. And I talk about that in two different ways. One, the wounded in terms of kind of fraught place of queer sexuality within Black community. So, gay, lesbian, bisexual, same-sex desiring people, but also the complicated nature of the politics of respectability that is so kind of diffused and continues to infuse responses to AIDS. So that's kind of one piece of the book. And then the other is kind of in this diasporic sense, of this diasporic framework, how activists use their work to kind of stitch back together, a global community, or to build connections within a global community that was, fractured and wounded by long history of, anti-Blackness and white supremacy going back to the transatlantic slave trade. So here I talk about AIDS as one of what the scholar Saidiya Hartman calls the afterlives of slavery. So it's those two things. And yeah, I just felt like that line captured that aspect of the project so perfectly that it had to be the title.
So, you've written this book, you have still connected to a large group of people who are wanting to tell their story. And I love the fact that you're putting together this digital project that can be seen. What are some of the takeaways that you made and after this book and in your discoveries and journey in writing it in the HIV and AIDS in the African American community, specifically in the Philadelphia area?
Yeah, I mean, I think the big takeaway for me is, one that other folks have argued. So, this is not an original point, is what I'm saying, but we have to look at health outside of an individualistic framework. Like, we have to look at health through, what some public health scholars call, or many public health scholars call, the social determinants of health. There's a sociologist, Celeste Watkins-Hayes, who writes about women in HIV, talks about injuries of inequality. We have to think more broadly about the causes of ill health, and to recognize the ways that ill health is a product of, is embedded in our histories, our built environment, so many things that are outside of our individual bodies. Because, as long as we think about, say HIV, just as something that you're exposed to as a result of the individual choices that you as an individual have made, we're really missing the big picture. I would argue that we should also think of AIDS not just as a disease, but as a symptom, and the disease as being inequality. Look at what we've seen over the last year and a half with COVID. It hasn't hit everybody equally. It's hit Black folks much harder. It's hit poor folks much harder. Prisons, people are incarcerated, people are in immigrant detention centers. I mean, there's so much outside of what you can control as a person that comes before you, that is outside of you, that shapes the ways that you can protect yourself from being vulnerable. And we need to address those if we, have any hope of making real headway against HIV, really against COVID, and against whatever the next epidemic is that's coming, that we don't know what it is yet. Because
it's secular. There is going to be a next one. I think that there's 2 points that HIV in it, if you look about how it has spread across, we'll just talk about the United States and which areas have been hard hit. We find that the Southern Belt has been really hardest hit in a way that that public health and people are just starting to grapple with. And I argue that was always there. It's that we're playing a whack-a-mole idea of where we're going to focus our energies. And so until we are able to focus it in a way that says we're going to be looking at these particular ideas, then we're still going to be here. And then the second one is really, we focus on the people who know some information. We don't focus on the people that don't really have the information. Therefore, they don't have a connection. They don't think they have a connection to HIV. And inevitably, everybody has a connection to HIV. And I think that that's where education is going to be most impactful when, much like Balm and Gilead, we go into communities that don't see their connection. They don't see themselves because they're stuck in the stigma of what HIV is. And since they're not of those communities, whatever those communities are, then they don't think that there is a problem. And so I think that the end of AIDS to me is definitely biomedical, but it's also in the way in which we talk to each other, the way in which we communicate and spread the word, so to speak. Where do you find yourself in that conversation?
I mean, I think, you know, what you were just saying about communities that don't, it's the known knowns and the unknowns, right? The communities for whom AIDS is an unknown unknown. You know, I think that, you know, in a lot, well, I don't know. I can't say authoritatively on this. You know, but what I think of are, you know, the communities where we've seen major HIV outbreaks in the last couple of years related to the opioid epidemic. And they're in places like, what is it, Scott County, Indiana? The county is like Southern Indiana, you know, West Virginia. You know, it's among, you know, the really immiserated, poor white communities where, I mean, really, the lack of knowledge is pretty astounding, and the stigma is astounding. And then you couple that with, you know, with the continuing stigma surrounding things like needle exchange, where, you know, these communities that are having major outbreaks, you know, don't have the tools that are proven to work because their leaders won't sign on to them, right? So, you know, I think about that. And, you know, there's something there about, there's something there that connects to the conversation that we've been having for, you know, the past 5 years or longer. It's not just about HIV in this country, but about, you know, the things that connect people who are vulnerable, you know, and poverty is a big one. Poverty is probably the thing that connects, you know, people who are vulnerable, regardless of skin color. Obviously, like, that is deeply also connected with white supremacy. Like, you know, capitalism, white supremacy, they really go together in this country. You know, but you know, it's white supremacy that keeps people in those communities from seeing that they have a kind of common cause with people who don't look like them. And, you know, whenever we get to this like part of a conversation like this, and I'm like, oh, well, like, you know, to solve AIDS, we just, you know, like undo white supremacy, or, you know, like make capitalism like work at least better for everybody. You know, it's like, okay, that feels like a big project. So yeah, I mean, but we can think of different, you know, we can think of all kinds of levels of intervention, right? You know, we don't want the problem to become so big in our minds that like we don't do anything about it. So, you know, but I do think that we have to also, you know, we have to, you know, to go back to the old like ACT UP slogans, like we have to get drugs into bodies. We also have to get bodies into care. And so that means in places like Florida, we need to expand Medicaid. In Georgia, in Mississippi, in Louisiana, no, Louisiana did. So Georgia, Mississippi, Alabama, you know, we need to expand Medicaid as like a first step toward getting healthcare to everybody so that people have, you know, all of the tools that they need to keep themselves healthy. You know, and then maybe we can tackle the other stuff too.
Yeah, I think that's what I come back to in this is sort of actually the sort of brilliance of your work in this, and this beautiful parallel of you coming into a community and you know, asking this question about you know, well, you're a white person writing about the Black experience, but I think that that's where we are in the epidemic at this point, that we need to really figure out a way for us to create community that includes everybody in the conversation, and that even if it's not specifically my community in the moment, it's part of this larger picture. And so what we've tended to do, especially in AIDS, is say it's a problem that's over there somewhere, right? And so it's over there, therefore we don't need to address it. And then it comes home, whether it shows up in Scott County, Indiana, or, and I think that's the real problem right now from an epidemiological perspective, is it's very hard because things pop up over here and then they go back down and then they pop up again and then they go back down, and it's confusing. But it comes back to all these larger processes that we have to have this dialogue about, and it's truly a dialogue. It's not just we can't just go in and say, well, what does the Black community needs to solve Black AIDS, or whatever the group is. And I think we do a lot of that stuff. And so I just really applaud you. And this is why, academia is really important in kind of thinking through our assumptions, and showing people, like, we've got all these assumptions about how this works. And we want to challenge that. And I think that's the fun and impossible thing to do in history, is to lay that out for people and really challenge them.
It reminds me of a couple of weeks ago, I went to an exhibit down in Miami, and it was a end of the exhibit, a moment in time, 40 years of HIV and one person's pandemic, through the pandemic. And there were students who were doing some research on a collection that was just brought in. And this one student said something so profound to me. And she said, this African nun, and I'm not sure which country, I want to say Zimbabwe. And she said, it's one world, one hope, one world. And that unless we look at it as one world, I know there are nuances in that, but still, prevention is prevention. We can at least tackle that. The biomedical virus issue around that is something that's definitely challenging, but prevention is something that we could get a hold of, one would think. And that's why that one hope, one world really stuck with me, as a way to say, what you're dealing with is what I'm dealing with. And so why can't we just work together on that? It's a bigger picture, bigger issue. I get it. But yeah, I am shocked that the time is gone, which is always what happens. But one of the things that we really, after having a healthy conversation like this, and I appreciate your candor and your willingness to go down the rabbit hole that sometimes happens here, because you never know what comes up, but these are really valid things that people are talking about. And so that's why I really enjoy doing these conversations, because you never know where they're going to go, and yet they're all relevant to what we're really working on. But in the face of all of that weighty conversation, we always ask people, what is it you do to decompress, to just, what does Dan do when he's not doing any of these things? And I'm sure one of them is right next to you.
Yeah, the dog has been an important, the dog we got during the pandemic, because we needed more love in our house. Not that we don't have enough, but we got the dog. So long walks with the dog. There he goes. Long walks with the dog. physical exercise is really an important part of the way that I take care of myself. So I haven't been running a lot lately because it's really hot, but running, biking, swimming, yoga, those things are really important to me. They're really vital to my like self-care. I like to cook. Cooking is really meditative. It's also one of the ways that I express love to other people. So
what do you like to cook?
Oh man, I've been making a lot of Chinese food lately.
Really?
Yeah. So you kind of a lot of like Sichuan stuff. Mapo tofu. That's a good one. Yeah, I mean, the COVID has given us so much opportunity to like to try lots of things cooking wise, but yeah, we've been I don't know, the last couple of months, like going to like the Asian grocery stores a lot more and like trying different kinds of ingredients. There's a couple of Italian recipes that I have been making consistently throughout the epidemic. Marcella Hazan's like different tomato sauces. The one that's just like you take a can of tomatoes and an onion that's cut in half and like 5 tablespoons of butter and you simmer that for 45 minutes. I make that a lot. That's a favorite.
Sounds good.
It's really good. So,
that does sound good.
Yeah. So yeah, that's how I take care of myself. But I'm really lucky in that I also find the work that I do just really enjoyable and gratifying. I find it very satisfying. So I'm lucky in that way, in that even though the subject matter is often really heavy, I get something out of the work too. So yeah, but yeah, self-care still very necessary.
No, I was just agreeing. So you moved down from, did you move to Florida from Philadelphia?
Yeah, in 2015. So I've been here for almost 6 years. It's almost exactly 6 years right now. Yeah.
When you talk about the heat, that's what I always say about running in Florida. I sweated from body parts I didn't know I had.
Yeah.
It's just like, oh my gosh. So
yeah. And Philadelphia in the summer, no picnic, but South Florida really is just a whole other special level of hot and humid, especially this time of year. So maybe when it gets a little cooler, I'll get back out there. But for now, mostly swimming and yoga and stuff like that.
Wonderful. Well, we really appreciate you coming on and talking about your work and being so open and kind of, like Raquel said, going down the rabbit hole with us on all these different areas. But it really is an important conversation, and thank you for your contribution to that. So
thank you both for having me.
Yeah, and this is only the beginning. So you're not going to get rid of us that easy.
No.
So thank you all for watching today's Spotlight interview. We do these on a regular basis on Facebook Live. So look for our next installment. It'll be a surprise what that's going to be. And you can also follow us now on YouTube as well. You can find our interviews on YouTube, and they're always available in both places at the World AIDS Museum and Educational Center. So thanks again to Dan, and have a wonderful rest of your day. Thank you.
Thank you, Dan.
Good to talk to both of you.
Absolutely.